Hi, I'm Dr. Joe Cohen, and I'm the Medical Director for Holos Health. Holos Health is a medical practice located in Boulder, Colorado that specializes in medical marijuana evaluations. I've been performing these evaluations for approximately 4 years. In addition to providing patients with medical marijuana evaluations, we also have an arm of our practice known as Journey to Life. Journey to Life is a practice involved with functional medicine and women's health. Functional medicine is all about the prevention and treatment of chronic disease. The practice of functional medicine is around nutrition, lifestyle, and supplementation. We look for triggers of disease and try to eliminate those triggers so that you don't need unnecessary medications, surgeries, and hospitalizations. We also have several practitioners with us, including a body worker, a shamanic healer, as well as an exercise physiologist and nutritionist. We also have 2 Chinese medicine physicians who are acupuncturists as well. First of all, I wanted to discuss exactly what's going to be happening with medical marijuana dispensaries. So the issue at hand is a question that many of you have had when you come to my office. That question is regarding why should I keep my medical marijuana card when recreational shops are about to open here in Colorado. Dispensaries have 3 choices. The first choice is simply do what they're doing now, just stay medical marijuana dispensaries and not change anything. Many dispensaries will be staying medical. If this is the case with your dispensary, then nothing changes. You maintain your membership, they grow your plants, and even if you're under the age of 21, you can still go to that dispensary to get your medicine. Second, some dispensaries will be going strictly recreational. If they are a strictly recreational dispensary, or what we call retail shops, anyone, whether they be in-state residents or out-of-state residents, can purchase from that dispensary as long as you're 21 years of age or older. Third, some dispensaries will actually be doing a combination of 2 things. They'll be both recreational and medical at the same time. If you have a dispensary which sells recreational marijuana as well, then you cannot go into that dispensary if you're under the age of 21. That is not allowed by Colorado law. So what some dispensaries have done is they've done a combination of 2 things. They've actually purchased a second site where one will be medical and the other will be recreational, or they've opened another facility right next door which has a totally separate entrance and a separate inventory. Another way this may impact you as a patient is going to be the cost of marijuana. If you remain a patient within the existing system and you're going to a medical marijuana center, there will be no change in the price of this medicine. However, if you decide not to renew your medical card and you were to go to a recreational shop to purchase cannabis, it's going to be significantly higher in price. The breakdown is as follows. The state of Colorado has already approved through a voter initiative this past November the 2 taxes on marijuana. One is a 15% excise tax, and the other is a 10% state sales tax. In addition to this 25% from the state, most cities and counties are going to apply their own tax, which is probably going to average somewhere around 5%. That leaves a total of 30% additional tax to recreational users that does not apply to medical marijuana users. What that means is if you were to go to a medical dispensary and say spent $200 on an ounce of marijuana, that same exact ounce would cost you $300 at a retail shop. In addition, the state of Colorado has decided to decrease the cost of renewing your license. As of February 1st, 2014, the cost of renewal will go down from $35 state fee to a $15 state fee. Considering the fact that it'll cost you an extra $100 for an ounce of marijuana, plus the fact that you have decreased state fees, when you add that to your doctor's visit, you will pay more for 1 ounce of marijuana going to a recreational facility than you would if you were just to have your card renewed, and that includes a doctor visit. The next thing I'd like to address is some other factors that come into play. Strains and choice of marijuana will be somewhat restricted at retail shops, but will not be restricted at medical marijuana centers. The quantity that you can purchase at a retail shop is going to be different as well. Right now, under current law with medical marijuana dispensaries, you can purchase up to 2 ounces at a time, unless you have a edible card or an indication to have a higher plant count, which you can receive from your physician. Then it can go to 4, 6, or even 8 ounces, depending on the number of plants you're allowed to have in your possession or that your caregiver can grow for you. If you have a private caregiver, you need to stay medical. Private caregivers cannot grow recreational marijuana. They can only grow for patients. If you have a higher plant count, in other words, you have anything more than 6 plants, you must stay medical. Another factor that comes into play is having an extra layer of protection that you will have with medical cannabis versus recreational use. That may come into play through being drug screened at an employer, or it may be an issue with law enforcement. Many communities have banned the sale of recreational marijuana. This includes communities as large as Colorado Springs. So there's going to be areas within this state where people won't have recreational marijuana available to them. I believe that retail shops are going to be more for the tourists and less for medical users. I think that if you were to go to a retail shop just one time and paid that extra tax, you'll be back getting your medical marijuana card. I hope this clears up any confusion that you may have or misinformation that you may have received from others. I look forward to seeing you in the future. Thank you for listening.